According to UNICEF fact sheets, an estimated 34 million people were living with HIV as of 2012, 3.4 million of which were children under 15 years of age. The awful statistics do not end there. Roughly 17.1 million children under the age of 18 have lost one or both parents to AIDS. Children with AIDS have an increased risk of poverty, homelessness, school dropout, and discrimination. And despite the current world efforts made today, over 7,000 people become infected each day, and 5,000 die from AIDS each day. HIV and AIDS is mainly vulnerable in poor countries because of the poor resources in healthcare, medication is expensive, and people are uninformed. The World Bank website states that despite the increase in AIDS funding during the past decade, financing gaps persist. International assistance declined from $7.6 billion in 2009 to $6.9 billion in 2010. It further explains that for every one person currently getting treatment for HIV infection, 2 are infected. The Global Fund is an international financing institution that has become the main financer of programs to fight AIDS, tuberculosis, and malaria since its creation in 2002. Currently, programs supported by the private-public partnership has provided AIDS treatment for 3.3 million people. The Global Fund is making the biggest impact on the epidemic. By the end of 2010, more than 5 million people in low and middle-income countries had access to antiretroviral therapy. 3 million of those people were receiving it through the Global Fund financed programs.
Let me just take a moment and just stop and think. 10 years in. $7.7 million people are alive because of the Global Fund.
But in 2000 and 2001, the rich countries were just letting everybody die.
We were fighting the equivalent of a civil war, but one without guns. The fact that people could buy life made it very, very painful.
That it was an accident of geography, of longitude and latitude. Where you were born decided whether you would live or die.
AIDS, of course, was increasing. Tuberculosis was not dealt with, and malaria was a scourge that was there, and very little was being done.
When I was president, and for the years before, there was a sharp global divide between the countries and citizens who could afford medicine and those who couldn't.
Join Red is a program that partners with some of the world's most iconic brands, which agree that 50% of a Red product's profit is sent to help eliminate AIDS in Africa. The profit is sent directly to the Global Fund, which uses the money to finance HIV health support programs. To date, Red partners and events have contributed more than $190 million. 7.5 million people have been impacted by the efforts. According to the website, due to support from funds from the Global Fund and Red, there have been more than 240,000 HIV-positive people on ARV treatment. Join Red has involved hundreds of products from over 70 countries, such as Apple iPods, American Express cards, Gap, Nike, Starbucks, etc. One of UNICEF's main goals is to prevent the spread of HIV and AIDS. It does so in 4 ways: preventing mother-to-child transmission, providing pediatric treatment, preventing infection, and protecting those already affected. As of 2012, in Eastern and Southern Africa, 68% of pregnant women living with HIV received antiretroviral treatment. The response to ending mother-to-child transmission is known as PMTCT, which provides drugs, counseling, and psychological support. In response to the epidemic, the World Bank works to provide effective prevention, care, and treatment, as many other organizations also do. The World Bank is one of the 10 co-sponsors of UNAIDS. It has extended its aid to Dubai, Botswana, India, Brazil, Thailand, and many sub-Saharan African regions in efforts to minimize the spread of HIV and AIDS. UNAIDS is an organization that created the 2011-2015 strategy Getting to Zero, The vision of UNAIDS is to get to zero new infections, zero AIDS-related deaths, and zero discrimination, all by 2015. UNAIDS has worked diligently to create a global agenda in response to the AIDS problem. In order to obtain the vision of zero, UNAIDS is working to revolutionize HIV prevention by incorporating new technologies and providing comprehensive sexuality education. It is also working to attain development of simpler and more affordable treatment, strengthening community efforts in delivering services, and working with partners to scale up access to tailored care. Lastly, it wants to reduce discrimination and advance human rights and gender inequality. These current organizations make efforts to suppress AIDS and HIV in the following ways. First, through the use of education. Many people in developing countries are extremely uninformed about the diseases such as HIV. The second is by eliminating mother-to-infant transmission with treatment and providing antiretroviral therapy and medication for those already suffering from the disease. Some organizations, such as the Global Fund, provide condoms in developing countries. A recent article posted in the New York Times covered Cuba's current success in tackling its AIDS epidemic. The article states that Cuba now has one of the world's smallest epidemics, with an infection rate that is 0.1%. That is 1/6 of the rate of the United States, 1/20th of nearby Haiti. According to the article, Cuba gives adolescent citizens graphic, safe sex education through their school years and provides free and easily attainable condoms nearly everywhere. Cuba also closely documents and tests those who are sexually active in order to monitor the spread of the disease. With these efforts, only 2,364 Cubans have died from AIDS in the last 3 decades, in comparison to the 78,763 infected in New York alone. Despite Cuba's obvious success, the rest of the world still struggles to reach the goal of an AIDS-free generation by 2015, which is why the epidemic still needs a lot of attention globally. That's where new measures come into play. The first major step in raising money for AIDS efforts is by targeting the consumer world. It is necessary to convince more partners or companies to participate in Join Red. The more products to cooperate, the more money will be donated to the Global Fund. But the benefits do not stop at that. With more products labeled red, consumers will be more aware of the program and can feel compelled to make more of a difference. To make this mission possible, we have to target brand names such as Uggs, Coach, Ralph Lauren, and Dunkin' Donuts. Another thing that must be done is making medication and access to therapy more accessible to developing countries. 2 pills needed to treat HIV and AIDS cost just 40 cents a day. It is a global mission to create universal access to antiretroviral therapy and the means to deliver it to developing nations.
I know it's just been 10 years, but so much has been accomplished. Together we've worked to turn around these pandemics. We can all be proud of what we've achieved, and we must all be determined to finish the race.